Guys, this is Dr. Rob Boyer. I'm at The Joint in Durham, North Carolina. I met recently with one of the owners, and he liked my method of teaching the patient why they need to continue with their care in case they want to cancel, or when we're actually doing the introduction of what chiropractic is all about. I use 3 tools. I use the spine. I use a forearm rehab for tennis elbow device. It's made out of rubber. It's flexible. It's like 1.5 to 2 inches thick. And then I use the back talk fixation stick. I don't know if you've ever seen this thing, but the owners of The Joint are talking to us about getting a bunch of these. So when I'm first introducing how it is that the body's creating pain, I keep it really simple, and I just talk to them about joint dysfunction. So I'll mention to the patient that if they have pain in the neck, thoracic area, or lumbar spine, what's typically going on is you have your biomechanical functionality that's compromised. And so to make it simple and understandable, I'll explain to the patient that you have muscles that move bones, and when those muscles are part of the discomfort or the pain that the patient's feeling, I'll tell them that the muscle's in a state of spasm. And then that spasm exacerbates, makes worse, the joint dysfunction. So then I introduce the back talk stick, and I'll say when you have fluid, good motion in your spine, it doesn't hurt, you can move freely, everything's functional. However, in areas of pain, what we find is there's biomechanical compromise. There's that stiff portion to the spine that doesn't move as fluidly as it's designed to. So I'll tell them that the pain in that dysfunctional area is driving spasm. And so when we get rid of that pain, we are seeing a reduction in a variety of problems. We're seeing a reduction in the spasm and a restoration of normal joint function in the area that was previously compromised via spinal manipulation. So after I adjust the patient's spine, I tell them, then we're reestablishing normal motion. And motion is what allows joints to receive their food, remove their waste, and sustain their health. So the chiropractic approach, and this ties into the back talk fixation stick script, is you can take medication and try to forget about the pain. Most of them have tried that. You can massage the soft tissues on top of the joint dysfunction, but that doesn't get rid of the biomechanical aberration. Or the chiropractic answer is we actually go right to the source of pain, the cause. We manipulate that portion of the body, whether it's spinal or extremities, reestablishing normal joint motion, which allows for the joints to heal. Dr. Wigurski liked this, as did the owners of The Joint, because a lot of times patients will say, well, why do I need to keep coming back? And in that situation, I tell them, look, this dysfunction didn't establish itself overnight. And you're not just a mechanical device that when we free up the movement in this area, everything else is fixed. I tell them, you have a propensity to have the problem again in the future, but to fully solve the problem, we've got to reestablish normal joint biomechanics so that the muscles can heal, the local nerves can cause the biomechanics to function in a sustained manner, and that the joint biomechanics can get reestablished. So when I'm doing my pitch after I do the exam and kind of a report of findings, as brief as it is at The Joint, I tell them, look, I'm going to need to see you for at least 8 to 10 visits to get this all to resolve. 8 to 10 visits is a good segue to my wellness coordinator to do a 2-month commitment to the wellness plan, which is what we want to do, right? We're trying to create members. So I think everybody who's been through chiro school gets all this. So the beauty of this thing is it's really flexible, and they get it. They get the whole tie-in with muscle spasm. Then they get this visually because it's so simple. Good fluid joint motion versus compromised motion. And then you pull the little ball at the end, and then that allows the restricted area to show as a fluidly moving joint. So when patients want to quit or not renew, I will take this thing out and I'll say, do you remember when you first came in, your low back was hurting and there was a lot of joint dysfunction in that area? The reason why we're encouraging you to stay on track with us is so that we can keep this from coming back. And that requires maintenance visits, just like brushing your teeth or flossing your teeth or changing the oil in your car, stuff like that. All right, so I'm going to role play with Cassidy, who's a wellness coordinator, and just kind of show you how I do it, all right? So Cassidy's going to step into the screen. Hi, Cassidy. I'm sorry to hear you're leaving the joint. So what's going on?
Oh, I have some lower back issues.
Okay, but now you don't want to sustain your membership anymore.
That's correct.
And they have asked me to explain to you or just talk to you a little bit about what's going on. Is it a money issue or is it a...
Yeah, it's just a little money issue.
Okay, so before we finalize that, I just want to explain to you, essentially, as we discussed that first day when your lower back was really sore, essentially what you can expect.
All right.
Okay, so once you do hurt your spine or the mechanics of your spine, essentially what happens is you have now developed a vulnerability in that area.
Mm-hmm.
So when we're doing chiropractic care on an ongoing basis, we're trying to remove the dysfunction in that part of your lower back that causes the muscles to spasm and guard that area. The reason why you're not feeling it now is I've seen you recently, and things are biomechanically starting to improve. But before you were to quit your membership, I want you to consider this. The back, the spine, requires ongoing care. And we at The Joint are as affordable as any other practice in the area. So I want you to think about, and I'm not saying you have to do this or not, but think about continuing with the care, because what will happen typically is you'll leave and then you'll go about your daily activities, and then this will become reestablished.
Okay.
All right, so to prevent the joint dysfunction, you coming in once a week or every other week on a wellness plan or to buy a group of visits, we're going to keep the muscles so that they're not in spasm, and we're going to keep that area that's vulnerable to re-injury into its level of functioning. Does that make sense to you?
It does.
Okay, great. So anyway, so that's something you can present to the patient when they're ready to cancel their membership. Thank you.
Very well.